dentist is quite possibly one of the hardest professions you can become. Not only are you fighting with impossible teenagers, but also the impossible battle against chocolate. And I'm here with someone who's excelled in it, Dr. Anushree. So why did you choose to become a dentist, and why a dentist amongst so many other fields of doctoring?
So, I always wanted to be a doctor to begin with. I have a few doctors in my family. So, while growing up, when the time actually came to choose the line that I would want to join, I was guided by them to choose dentistry because they saw it as a much more promising field with a lot more advancements left and a lot to explore, yet live a disciplined life. So that was the reason I chose to become a dentist, that I would be able to live my dream of being a medical professional and in a very structured and balanced way.
What trends that you see your teenager patients who are teenagers, they follow such trends that they often see on social media that hampers their teeth a lot?
So I'm an orthodontist. So that means that I deal with a lot of teenagers for braces, aligners, and teenagers have a lot of research that they do themselves on social media. So they get a lot influenced by teeth whitening, which they would want to do over the counter with a lot of toothpaste, which are in fact harmful for the teeth, but because they are promoted in a very fancy way on social media, so they miss the point and yet use products which look very fancy and may end up damaging the teeth.
So, as you said, you work with young children or teenagers. So, especially for young children, how do you convince them and build trust with them over, for say putting braces? It can be extremely tough process. So, how do you build that relationship in which they feel comfortable enough to be operated on for tooth canals?
So, to answer the question of braces, honestly, teenagers love braces. Okay, it's like a statement which puts them in their fashion forefront. So, convincing them is not difficult. Coming to the pain part, there is honestly no pain in the treatment. So, that makes my job very easy because I don't have to convince them to go through the pain. I make sure it is absolutely painless, it is simple, it is quick, effortless, and honestly, the teenagers today are very intelligent. So when you explain something to them and they can actually connect and they see that what you're saying is true, they build that trust, and then it's very easy to get them to do what you want them to do. And it makes my job very, very easy.
So, especially since you've been a dentist for so long, what's one thing about this field that you've learned from your experiences?
So the most important thing that I've learned about this field is to be very, very honest with your treatment plan that you are planning for your patients. To give them what they genuinely need, planning the most planning a treatment which is comfortable and going to serve them in the long run, not overdoing it, neither underplaying it. So if you work with honesty towards a treatment plan, I think that's the most important thing in the long run to have confidence of your patients.
So I feel I have to ask the question for all teenagers: genuinely how bad is chocolate for us?
So chocolates are not bad. I don't know why chocolates are being labeled as the enemy food. Chocolates are not bad. The problem comes when we overdo chocolates, when we are eating too much of them and at the wrong times. So when you're doing a lot of late night munching and then going to sleep without cleaning your teeth, brushing them, then the chocolate sticking on is a problem. Consuming them every day is a problem. If you restrict your intake and eat them smartly at the right time and clean your mouth after it, chocolates are not harmful for teeth. So it's just the way of consuming it and the time of consuming it which does the damage. Chocolates are not a problem.
So, what are some of the core principles that you have maintained throughout your journey as a dentist?
Again, number one, I would say honesty with my treatment plan with my patients. Number two would be empathy. Only if I understand that there is an inbuilt fear that most of the people have towards dental treatment, I will try and be empathetic towards that and be kind in understanding that fear and help them overcome it with me so that they are comfortable in the process, and last but not the least, fun. I can't work in a boring way. So there has to be fun around the treatment, especially with children. So if that is there, these are the three core principles: that enjoy what you do, be honest, and be empathetic. The job is done.
So, what would you say is the biggest myth about our teeth that you have to constantly deal with?
So the biggest myth about teeth is honestly taking care of them. Some people think that brushing twice is not important. Some people feel when we tell them that you have to floss, they feel flossing is meant for only some special people who have a problem. Flossing is as important as brushing. Visiting a dentist for cleaning. So the biggest myth is that cleaning will weaken the teeth or it will make the teeth thinner, whereas it's just like having a bath or using soap. So how can that be damaging for your teeth? So honestly, in India, there are a lot of myths about how to take care of your teeth. Just brushing it once, that too not the right way, is not going to help the teeth last for a lifetime.
So, what would be your advice to the people watching?
The people now have a lot of exposure and awareness. So I would just want them to up their oral hygiene game, because our diet has changed a lot. There is a lot of junk food, refined food, and packaged food in our diet, which our teeth are not very happy with. So we have to go that extra bit of taking care of them, brushing twice with the right toothpaste and the right toothbrush, flossing non-negotiable, and visiting your dentist once a year for a cleaning and a thorough evaluation is a very simple process to make sure you have lasting teeth with no gum disease, no teeth disease for a lifetime.
So, what would you say is the best food you can eat for your teeth to be healthy for the longest time?
Food with fiber and roughage, which would be salads and vegetables. Raw salads and raw vegetables, if they can be incorporated in a everyday diet, then that is a game changer for keeping the teeth healthy, clean. For example, as simple as an apple, guava, carrots, cucumbers. So we tend to not consume them on an everyday basis. Things which have fiber, roughage, and are slightly harder in texture, they should be consumed every day.
Since you do braces and treatment for so many children, especially teenagers, how do you make sure that they follow up properly and get their full treatment done and not just run away after just getting their braces done?
So I told you that fun is a very important part of our treatment. So we incentivize their treatment. We give them stars for the efforts that they make, for coming on time, for brushing their teeth well, for not breaking their braces, and for having fun on Instagram and everything. And we give them Starbucks, H&M, Zara, whatever they like, and that keeps them very motivated for the treatment. This helps us finish the treatment in time and also keeps them excited about the whole treatment plan.
Thank you so much for the interview.
You're most welcome.